Catalyst is an independent physician group. We have close affiliation and partnerships with our regional medical centers. Our real focus is on finding any possible way that we can to improve the care resources for our community, really trying to advance healthcare.
I think that a lot of patients were frustrated with sort of this cat and mouse we would play. They would call, leave a message, and then we would try to call them back and miss them, and we would go back and forth, and sometimes it would take a day or two for a problem that really needed to be addressed within the hour that they called. We also had a lot of problem with having our staff be happy and satisfied because they were dealing with frustrated patients that were calling through and couldn't get what they needed, right? I think that those are kind of the stories that I would hear from my patients is, I love coming here, I love your nurse, I love your front desk, but I can't ever get a hold of you.
Assort has helped us in so many ways right now with them taking off a lot of our calls, whether it's just scheduling an annual, a problem visit that doesn't need to be seen urgently. It frees up my call center teams to be able to have more of a one-on-one conversation with those patients that need that extra time or that extra attention for whatever their needs are. Nobody likes to hear that you're 8th in line or your hold time's 23 minutes. That is one thing that I'm hearing is people are able just to call in. They're always gonna be first in line with Assort. There is no 8th in line, there is no 23-minute hold time. They're first in line. So if they're able to make that appointment, they're gonna do it and they're not gonna have to wait.
Assort is helping us in all of our areas in our clinic, which include orthopedics, foot and ankle podiatry, OB, GYN, dermatology, primary care, and pediatrics.
Our orthopedic department is highly specialized. When patients are scheduled by Assort, knowing all the logic that we built specifically for orthopedics, all of those boxes were checked. So if we needed to check for imaging, I know that it was asked, or if a patient's been seen by another provider, it's asked every single time, and so I don't have to question whether or not the patient just left something out. So Assort's taking out that human error. We need to make sure that the provider's preferences as far as scheduling and the appointment types are scheduled exactly as is. So for instance, if we have patients who have had prior surgeries, we were able to build that into the logic. Some of our more complex appointment types, like our injections, we've gotten to a spot where we now are able to schedule those, and they're being scheduled correctly, which is a big deal.
We are part of internal medicine, which is an older population of patients. We've heard good things from our patients about being able to navigate through the system, getting what they need. We have a lot of options in primary care to schedule appointments, and this has just been another layer that our patients are like, this is great. I can schedule online, I can call, I can do whatever I need to make a quick appointment. And so we've gotten really good feedback.
I think that collaboration and that teamwork between our team of professionals and leaders and the partnership relationship that we've had with Assort has really been the key to the success